Dr. Vikki Petersen here. I wanted to talk to you today about autoimmune disease and how it relates to gluten. Celiac disease is a known autoimmune disease. It's one of over 100 different autoimmune diseases, but it's the only one where the absolute trigger is known, and that is gluten. So someone can be diagnosed with celiac disease, remove gluten, and the damage that's being done to their small intestine will improve. I wish that was the only step that needed to take place for the small intestine to completely heal, but that's a different story. We know there's also a syndrome or disease called gluten sensitivity, which is different than celiac disease because people who have gluten sensitivity don't destroy their own small intestines the way people with celiac disease do. And it's thought to be a difference in genetics, actually. So there are genes that kind of code for celiac disease and different ones for gluten sensitivity. But the point that I want to make is that there are schools of thought that if you don't have celiac disease, then gluten cannot be playing a role, likely, in your autoimmune disease. And clinically here, at our office, we do not find that to be the case. We find that patients have autoimmune disease that does improve when we remove gluten from their diet, even though they don't have celiac disease. And the reason I wanted to talk about it is that at the moment, autoimmune disease is our third leading cause of death when you take all the autoimmune diseases together as a whole. Now, as I said, there's over 100, and type 1 diabetes, rheumatoid arthritis that I'm going to be discussing in a moment, multiple sclerosis, lupus, Sjogren's. There's a lot of different diseases, but when you do take them together as a whole, they're the third leading cause of death. Also, they have been doubling every 15 years for the last 75 years, autoimmune diseases. Now, we know there's a genetic component to autoimmune disease, but that rapid rate of increase, doubling every 15 years, is not explained by genetics. Our genes do not change that quickly. So we have appreciated the fact it is more of an environmental impact. So putting all that together, and then I want to talk to you about a patient of ours who has rheumatoid arthritis. She's in her 60s. She has had rheumatoid arthritis diagnosed for over 30 years. During that time, she was on every drug possible for her rheumatoid arthritis and really saw very little change in how she felt. If you've ever seen someone with rheumatoid arthritis in their hands, their joints can get very deformed and kind of gnarly looking. They pretty much lose the use of their hand, and this individual was no different. Now, she had heard about us through the gluten connection, and that's why she came into the clinic, because she was kind of suspicious that maybe this was bothering her because she had such severe autoimmune disease. Well, I shouldn't say that's the only reason, because we do this with all our patients, but we definitely wanted to make sure that we checked celiac disease as well as gluten sensitivity, as we do for everyone, but we absolutely made sure which category she fell within. And she fell within the gluten-sensitive category. She did not have celiac disease. And over the course of only 2 months, and once again, this is a woman in her 60s who has been suffering for 30 years, she saw marked change in not only how her joints looked, but better yet, how they felt. She had open sores on her hands because her joints were so inflamed that it actually was splitting the skin, and she had infections. That all healed. So first of all, the skin healed. Then actually the stretched out skin from these swollen joints actually started puckering because the size of the joints was decreasing. Remarkable, well beyond anything we thought we would ever see. She actually started getting use of her thumb again. She hadn't had use of her thumb in many, many years. She fell down at home, was able to get up on her own, which she had never been able to do. She would always have to kind of crawl on the ground, find the telephone, and call for help. She's back at work, something she hasn't done in several years that she very much missed working, and she's back doing that. Her range of motion, or how much she can move her neck and her knees and her hips and most of her body, has improved dramatically. And I bring this story to you not only because it's a great story, but because what's happening currently is we're getting better. Certainly our awareness is increasing about gluten, but we're a little bit pigeonholing. People with autoimmune disease could only be helped on a gluten-free diet if they have celiac disease. And we just do not seem to see that. Certainly with celiac disease there's an association, but I believe with gluten sensitivity there is an equal association, and we do see this in our clinic and in our patients time and time again. So if you have an autoimmune disease, even if you don't have celiac disease, get yourself tested, find out if you're gluten sensitive, and try that gluten-free diet. It could make a huge difference in your autoimmune disease and of course in your health overall. Please feel free to contact me. I know this was just a short segment to talk about a very big topic, but I did want to communicate this information and I hope it was helpful. Until next time, I wish you very good health.